Dr. Adam Wilson of Steamboat Orthopedic and Spine Institute. In partnership with David Siegfried of Mountain Land Therapy in Granby, Colorado, we have created a video series of home exercise programs. These videos are intended as guidance for those patients who cannot attend in-person physical therapy or as a supplement to your physical therapy. If you are unsure if these videos are right for you, please don't hesitate to contact Steamboat Orthopedic and Spine Institute or Mountain Land Therapy. The following video is intended for those patients recovering from a hip injury or following hip surgery such as a total hip replacement.
Okay, we're going to try to get you to fire your quadriceps muscles here. So I want you to try to focus and see if you can tighten that muscle that I'm touching here right now. Very good. Okay, and relax. And repeat again. Okay. If you're having a hard time doing this, what I often have patients do is try to squeeze both quads at the same time. You're going to get a more firm quad squeeze, and a lot of times it will remind you of what muscle you're actually trying to squeeze or activate. Try to hold that squeeze for 3 to 5 seconds, and I instruct patients to repeat that anywhere from 20 to 40 times in a row. You cannot do enough of these exercises. So let's go ahead and just do a single quad squeeze on the left side. Good. Relax. And again, relax. And let's squeeze both at the same time now. And again, you should be able to feel that you get much more of a quad contraction with that. Okay, so we're going to see what your normal extension is. So go ahead and tighten up your quad and lift your heel up right off the table there. Okay. So notice how that is your full active extension there. You can also increase that by pulling your toes or dorsiflexing up towards your shin. So what we want to strive for is on the surgical leg is equal to the non-surgical leg. So go ahead and let's bring your other leg up here. Okay. And let's squeeze that quad and try to pull that up. Very good. Okay. And relax. One more time, go ahead and flex that quad. Let's get that gap there. There you go. And again, you'll feel that you can get a lot more quad squeeze by pulling those toes up towards the shin. Very good. And now let's do both at the same time. And obviously we see that they're pretty equal on both legs. Next we're going to demonstrate is a heel slide. And what I want you to do is you're going to slide your heel towards your bottom, bending your knee up. Good. And then back out. And then back up, back out. Very good. I suggest people to do this on a coffee table with a sock on, or to use a towel so they have a little less friction when they perform the exercise. So next we're going to do a ham set. So go ahead and start to do a heel slide. And pause right there. Now I want you to dig your heel into the table there like you're trying to make an indent. Excellent. And relax. Next, we're going to do a multiple exercise here. And what I want you to do is go ahead and perform a heel slide for me. And come back out straight. Do a quad set, really tighten those quads, pull that toes up, and then go ahead and keep that quad tight and lift up. And come back down. Very good, and let's repeat that one more time. Into the quad set, get a good squeeze, get that extension, lift the leg up. Right after surgery, a lot of times you'll notice that you can't fire the quad, and you'll see a leg where your lower leg just doesn't want to come up off the table. So go ahead and lift that up. And that's what typically you'll see as you first get out of surgery, is that leg. But what we want to strive is being able to lock fully out, whatever equal is to this leg, and lifting that leg fully up. Let's go ahead and perform a mini squat now. We want to rest our hands on the edge of the kitchen sink. We don't want to use the sink to pull ourselves up, but bearing the weight through our legs to perform the squat. We use a stable surface so that you can be comfortable and not feel like you're going to lose your balance or tip over backwards. Next, we're going to perform a marching in place exercise. Pick a cabinet drawer or a knob to aim for as you pick up your knee and literally march in place. Next, we're going to do a heel lift. We're going to bring our heel up towards our backside. Next, we're going to demonstrate a hip abduction exercise. So we're going to stand on one leg and bring the other leg out to the side. We want the patient to try to keep the toes pointed forward and not externally rotate. And we also want the spine to stay straight. We don't want to side flex or side bend in order to perform the abduction exercise. Mm-hmm. So I'll try to straighten out again. Back. Next, we're going to perform a toe push-up or a heel raise. So come up onto the balls of your feet. Very good. Now let's try to perform a single toe push-up or heel raise.